Welcome to the first Iowa Ideas in-depth week of 2023. This week, we're focusing on water quality with 5 virtual panel discussions over each noon hour this week. If you missed our overview yesterday, you can watch the recording at iowaideas.com. Thanks to our event sponsor, James C. LaRue of LaRue Law Office. I'm Erin Jordan. I'm an investigative reporter for the Gazette. I have the pleasure of being the moderator for this session on private wells, which supply drinking water to an estimated 7.6% of Iowans. Before we get started, I'd like to ask each of our panelists to introduce themselves and explain their connection to our topic today. Let's start with you, Sylvia.
Thanks for having me, guys. So I am a professor in the Department of Geographical and Sustainability Sciences at the University of Iowa. And I am interested in this topic from several perspectives. A couple of years ago, I wrote a co-authored a report with Dave Schwertney at the university on the Grants to Counties program, which funds testing for well water users in Iowa. I also helped out the Iowa Environmental Council write a report on rural water. And more generally, I study water quality issues related to agriculture. So I think this is a really, really important topic because well water users are the least protected category of drinkers, so all of us, in the United States.
Thank you. Ethan, do you want to go next?
Absolutely, and thanks again for having me. I am an environmental health specialist with Johnson County Public Health. My main role is in the watershed protection program. And what I do is I help with the permitting of private wells and private septic systems throughout Johnson County. And I also help administer the Grants to Counties program throughout Johnson County as well.
Thank you. Jesse?
My name is Jesse Campbell. I work with a not-for-profit Midwest Assistance Program. We provide water and wastewater education and technical assistance across our 9-state region. I do a lot of work in Iowa through our private wells program, which provides on-site well assessments to help well owners understand their water quality, groundwater protection, and public health, as well as we provide some testing through the program. And then I put on a lot of training events for environmental health professionals around our region, our 9-state region, and well owners as well in larger groups like homeowners associations and things like that. Go out and speak with them and just provide a lot of great education. So that's me.
That's great. Yeah, I think we're definitely going to have some questions related to those groups that, those homeowners associations and things later on in the session. So when I was doing some reporting for a story that we did last weekend about how Iowans get their drinking water, I realized I didn't know a lot about private wells. So it was an education for me, in part to realize they're only 4 to 6 inches wide, and they're lined with PVC, and they go up to 1,000 feet deep underground. Ethan, you go out and see a lot of private wells, in the course of your job. You probably see the whole gamut. I wondered if you could kind of tell us what kind of wells people are using out there.
Yeah, so obviously I see a lot of different kinds of wells, wells that are constructed up to modern standards. So they have intact lining, they have PVC lining, their casing lower than 40 feet below the ground surface. But I also see sandpoint wells that are less than 40 feet, some even less than 20 feet. And those are highly susceptible to surface contamination. So I see the whole gamut of these wells throughout the county.
And Jesse, what are some potential ways private wells can be contaminated?
Oh, just like Ethan was saying, there's such a wide spectrum of wells that it's hard to have that one definitive, this is how wells get contaminated. piggyback off what he said, like if they have a sandpoint well, they're highly susceptible to everything from the surface because it's typically a very shallow aquifer within 20 feet of the surface. And sandpoint wells aren't protected from the surface with grout and proper casing and those types of things. If they just go out and drive them into their backyard themselves, that obviously in Iowa, southwest Iowa, you've got a lot of large diameter wells, usually 36 inches, stacked concrete casing or tile casing. They could be anywhere from 12-inch to 36, but a lot of them I run into in that area are 36 inches. A lot of them are aging, so you have infiltration at all the seams. The stacked concrete is usually 3 feet. So that first seam is usually about 1 foot to 2 foot below grade. And once it starts allowing infiltration and you're having issues. But main contaminants sources that I see when I'm working in Iowa, you have the natural and then you have the man-made. Anytime there's surface contamination getting into a well, from any damage or maintenance issue, or even the construction of the well, you're getting in those nitrates, the bacteria, the surface runoff, like your herbicides, pesticides, things like that into a well. But then again, Iowa also has a naturally occurring arsenic in the silica sand beds. It has karst geological formations over in the northeast corner. It has just a wide range that well owners have to deal with different contaminants depending on the different wells.
Now, you mentioned, some of these contaminants are, there's a wide range of them. Some of them come from humans, others are naturally occurring. Sylvia, I was hoping you could tell us a little bit more about how the minerals in the ground and other contaminants can impair private wells, like things that are there naturally.
Well, arsenic is a big one, right? And that's one of the ones that actually we test. But the issue, I think, and both the other two speakers, both Jess and Ethan, illustrated it, is that this is very place dependent. And so unless you test or unless you have knowledge of the specific kind of like, topography, geology of a place, the depth of the well, right, what aquifer they're drawing from, it's very hard to make generalized statements. And the issue is all the information that we have is kind of like really piecemeal. So I can't tell you like, you're going to have this problem here and you're not going to have it there, because we don't really have a systematic program that, we don't have a federal program for sure. And then what we have at the state level is really hodgepodge. And we know, for example, think about the driftless, where we have that very porous karst territory. That's like a 3 to 4 state region, right? So I think the first problem we have here is a data problem. Like we can't assertively, cite with a good sound science behind answer questions like these, because we don't have a lot of information. And this testing is really, if you have people like Ethan who goes out and asks the homeowners, that's great, because then we get more testing, but we are limited in the amount of testing we do because the program in Iowa pays for arsenic, but doesn't pay for other things. For example, it doesn't pay for pesticides.
So we're going to get to testing and some of these policy issues, but yeah, I'd like to just, because some of the people listening are like me and they don't know, like Brittany asked about lead contamination. Just even though you can't generalize for every well, could you talk a little bit about some of the minerals underground that can affect our drinking water?
Well, I think in Iowa, the main issues are the issues that we test for, right? So it's the man-made nitrates and bacteria, and then the natural arsenic. And then I would say beyond that, we don't really have, and generally then if you have a problem with nitrates or bacteria, that's usually a sign that maybe you need to test for other man-made contaminants, right? But otherwise, it's a lot harder to generalize. Also, because to get data on this is very expensive, right? You'd have to get the Iowa Geological Survey guys to do work at different depths and in different geological formations. And so I don't know that I would feel comfortable going beyond that. I don't know if anybody else on the panel would.
You mentioned lead, Aaron, and just to touch base on that, I don't know the exact percentage, so I'm not going to try to quote a number, but a very high percentage of all lead that gets into public drinking water systems and private drinking water systems is from their plumbing. It's from their actual system. It's not from the ground. It does naturally occur in some areas. And there are some areas where there's been some industrial impact in the area that has left lead in the groundwater. But a very, very high amount of all lead tests that are positive is from the solder in the old copper pipes that were put in prior to 1980s. Old lead service lines that are still in service. In some cases, really old wells might have lead packers, or they might have some type of a lead service line going between the well and the house. If they've rehabilitated the house and all the plumbing's brand new, but they're still having lead issues, it could be that they have a really old well and they just haven't addressed that pipeline from the well to the house and addressed that issue. There might be an old lead coupler or something like that that's still buried in the ground that's causing them problems. And also lead is a major pH issue. Truthfully, I like to teach well owners that if you are cleaning scale off of your pipes, if you're cleaning the scale, you're not drinking your pipes. So when pH goes into the corrosive side of the spectrum, we end up with a lot more lead issues because you're leaching the lead out of the old plumbing overnight. Versus if your pH is really high on the hardness scale, let's say you got really super hard water, you're building scale, right? So all that scale is kind of coating the inside of your pipes. And a lot of times, even if they had lead pipes all the way through their whole house, they would never notice it because they have so much scale built up on the inside of their pipes that they wouldn't be having a lead issue. So just wanted to touch base since you mentioned lead. There is a lot of work going on nationally for public water systems on the lead and copper rule right now. It's a really great rule. They've been working it, revising it for public systems. And we can bring that knowledge over and kind of downscale it down for well owners and just explain those key points to them, that if they are having a lead issue, it is typically from plumbing. If they have a new well and they're still having lead and they've replaced all the plumbing in their house, they may want to address that line between their well and their house, those types of things.
I think that's a really good point in terms of another variable that matters, which is age of the well, right? And so if you are thinking about what may cause problems, and again, this is where sampling won't necessarily help, because it's not a matter of what water you're drawing from, what aquifer you're drawing from, is how old your well is and how well maintained it was from the people who owned the house before you, which you don't necessarily know anything about.
Yeah, and piggybacking off of what Sylvia said, we've learned a lot over the past several decades about what proper well construction looks like. So the standard practices have evolved over time. So you might have, you might be living on a farmstead where the well is over 100 years old and it's hand dug. And that was the standard at the time. That's what you had access to. So well age definitely impacts the quality of water that can come out of the well. And then I just wanted to touch on what Jesse said about lead, and it's definitely a chemistry issue. The leaching of lead from service lines and solder, lead can be immobilized, put into a different form, which is insoluble in water at neutral to higher alkaline, slightly alkaline pHs. So you'll want to watch out for that. What happened in Flint, Michigan, was when they changed the water source, they ended up having their water go from neutral to alkaline to more acidic, and that's what reduced the scale and mobilized the lead, led to the contamination.
That's great to know a little bit how that connects with the private wells too, and having lead there in those in some cases. I want to just talk a little bit more about some of the potential contaminants we're seeing before we move on to talking more about testing and regulation. But, obviously Iowa is a big agricultural state. I was hoping the panel could talk a little bit about how that affects groundwater and then maybe also the aquifers that the wells are getting the water from.
I can start off with that, but if other people want to chime in, certainly do so. Here in Johnson County, up in the northeast part of the county, and broader, applying this to the state as a whole, the northeast part of the state is in a region known for its karst topography. So there are fissures in the bedrock that reach up to the surface and allow surface contaminants to more directly impact groundwater. So this is where you see the input of nitrates, bacteria from manure application or animal feeding operations, and pesticides, herbicides, fertilizers, that sort of thing, getting into the groundwater.
So I would say that, this is a good place to compare what happens if you depend on a public water supply or on rural water versus if you draw your water from a well. In Iowa City, largely we depend on groundwater, but that water is tested. And so even if we have a nitrate problem, now there is another conversation about whether the standards we have now are adequate given the new science that has emerged. As Ethan was saying before, right? Things change and we get new information. And so we need to update the standards. But if we think that the standards we have are adequate, we don't have to worry because that water is tested constantly, right? I mean, some of the best information about nitrogens in water is from the Des Moines Water Works because they started testing, 100 years ago, right? So we are okay. But think about what happens to all those hundreds of thousands of Iowans and all the people around us. I mean, this is a problem for millions of people in the United States who don't have the same test capacity at their disposal. And so there is nothing done to address that issue. Now, they may have, some kind of treatment in the house. They may preemptively not drink that water and use only that water for bathing and things like that. But that's an expensive choice. Our money when we pay for our water bills actually is used for something. It's used to make sure our water is safe to drink.
Jesse, did you have something to add?
I was going to chime in on the contaminants. I work all over Iowa, so I tend to go from the furthest northeast corner to the furthest southwest corner. And I do truly believe that the Iowa Grants to Counties program does a great job of capturing the major highlights for contamination in Iowa. And I'm sure Ethan could probably explain the Grants to Counties program, or maybe Sylvia could even better, but they provide free water tests annually in almost all counties, unless your county is opted out of it. Almost all counties have a free water well testing program for every well owner in the state of Iowa. They can go to their county environmental health department and get a free coliform, nitrate, arsenic, and manganese test annually. And it's very underused. Along with that program, they also provide well rehabilitation. So if it's an older well that's damaged or it's causing problems, it's a groundwater protection program. So if it's causing problems to the aquifer, the county may be able to help reimburse them for part of the cost of that well rehabilitation, as well as well plugging for all of these abandoned wells. As I work across Iowa, I constantly find abandoned wells, and every abandoned well is a direct conduit for contamination to get down into our aquifers. So every single one that we can get plugged and do away with is a huge savior to the aquifers. So I think that my main point there was that Grants to Counties program is underutilized. I constantly meet with Iowa well owners that have never heard of it, and they're like, "Oh my gosh, I didn't know." And it's funded through your agricultural taxes in Iowa, so it's kind of your farmers giving back to help protect the groundwater or fix problems with the groundwater, however you want to look at it. And so every well owner in Iowa should be rushing out to their environmental health office and saying, "Hey, can I get involved in this Grants to Counties program?" And this is going to help with public health because they're at least going to have an annual test of those constituents in their water. It's going to help with groundwater protection because the environmental health individual can identify those problem areas and say, hey, why do we have so much nitrates in this area? It's going to help individuals like Sylvia at the educational level to have all this data across Iowa from all these different well owners saying, hey, this is what we're seeing. This is where we're seeing major spikes in contaminants. This is where we're seeing these problems. And then they can go, individuals like myself or like Ethan can go out to those well owners, do an assessment, find out what's going on, because a test without an assessment really doesn't tell you anything. You can tell a well owner over the phone you have coliform, go out and shock chlorinate your well. But many times I've walked onto the site to do an assessment with the well owner and said, you have coliform, but shock chlorination is not going to do anything for you, because if your well is not sanitary to start with, cleaning it is just going to clean it up for today, and tomorrow the contamination is going to be right back. So somebody has to go physically out there and take a look at these well sites before you can say, we have a ton of nitrates in this area, it has to be the farmers. But maybe you go out to the sites, you say, we have a ton of nitrates in this area because everyone's septic system is failing in the area, and these wells are old, and it's getting into the wells or getting into the abandoned wells in the area, and it's spiking the nitrates in the area. So there's a lot that goes with that. And I just wanted to chime in, and we can move on to another point if you'd like, Erin.
Well, so the Grants for Counties pays for 4 different, you said nitrate, manganese, coliform, and what was the fourth one?
Arsenic.
Arsenic. Okay. And so, but I understand there's still just a relatively small portion of Iowans who do that regular testing. I mean, you mentioned a lot of it's education, like maybe not knowing that that's out there. Do you think there's some aspect of like not really wanting to know because then it might be this big expense?
That's absolutely, I think, a deterrent for some people, because I run into people who say that, you know, they hadn't tested their well since they've been living in their house, you know, about 30, 40 years. And they just are not aware and kind of don't want to be aware about what they're drinking. Some people might think that, you know, it's fine to drink the water, and because they've been drinking it for as long as they have been, 30, 40 years, without any ill effects that they can attribute to that. But the Grants to Counties program, I think, is a very significant public health intervention, because we can track contaminant sources around these wells all throughout the state, whether it's septic, whether it's agricultural, whether it's chemical even. We look at those things in every survey that we do. So I would definitely encourage people to contact their county Department of Environmental Health and schedule a testing.
Well, I think this is another point that's really important about the program, which is that, you know, our county sanitarians and the people who administer these programs are often very overworked, and they have a lot of other responsibilities. And so they don't necessarily have the time and resources to go advertise the service. And so actually this thing that you guys are doing, what we're doing today, is an important part of spreading that message, because hopefully somebody tomorrow is going to call their county and say, I just heard that I'm eligible for this. But we don't really have some kind of like state level effort to make people aware of the program. And so I think it's really important, you know, whether you want to call it communication, education, that we have, you know, more voices out there reminding people that this is something that they can have access to. And as I said, I think, you know, maybe in Johnson County, we're a little bit spoiled, Ethan, because I think we have a little bit more resources than your average Iowa county. You know, and we can be more proactive, but in other places, the sanitarians don't really have the you know, the capacity to go out and tell people, hey, you know, this is a service we offer, and would you be interested?
Just to chime in real quick, Sylvia, I do know that I work with some counties in Iowa where the environmental health professional covers 3 counties, and that really stretches them on, well, they're trying to permit wells, they're trying to permit septics, they're trying to do all their other jobs. And and they're also trying to administer the grants to counties program. So I can definitely see that. And then there are also counties in Iowa. I can't specifically tell you which ones, but they are allowed to opt out of the grants to counties program, and some of them do. Even counties that are mainly public water that have rural water, though, they think that the 100% of the county's rural water, there will be well owners in that county. So it's up to the people that live in that county, if they realize that it's not available in their county, to maybe lobby their county leadership and try to opt back into that the next year, I believe, is how they would have to do it.
So in the last year, we've heard a lot more about PFAS, the per and polyfluoroalkyl substances, which are contaminants that are in water and soil and like everything. There's a new article every day about something that they're finding PFAS in. But I wonder, are you seeing, like Ethan, are you seeing much of that in Iowa well tests, or is this something that's just in more isolated pockets?
So we have been doing some preliminary test, or the DNR was doing some preliminary testing with us about a year and a half ago, 2 years ago. And we did identify some wells that tested positive for PFAS around the Eastern Iowa airport. Since then, the number has grown. We have found more wells that have tested positive for PFAS around the Swisher area. The state DNR and the state Health and Human Services Department have allowed the limited use of grants to counties funds for PFAS testing in these impacted areas. So we've been involved in some of this preliminary testing, and we are still finding it. Yeah.
Okay.
I think this is going to be a really big problem going forward, Erin, because this is a problem that we have for all water drinkers, and the information we have is very limited, and the capacity to address the problem is also limited. So I think that going forward, this is really something where, frankly, the feds should come in with big money to address the problem. This is something that goes well beyond the state capacity, in my opinion, to address.
And testing for PFAS, I don't know if Ethan or Jesse, I mean, it's a lot more expensive and painstaking, right? Because you can contaminate your samples, right?
Yes, it is. I've been involved directly in the sampling, and we do our testing through the state hygiene lab, and they charge $370 as the base price for the test. And if it comes back positive, they have to test the field blank that you collect with your sample, and that's another $370. So it can be up to $740 for a private resident to get their well tested by themselves, which is why it's been such a great public service that the grants to counties has been opened up for use for testing this in these affected areas. And I'd just like to clarify that in the DNR's initial survey, they didn't find any PFAS around the Coralville, Iowa City, North Liberty areas in any of the public wells there. It's more been the private wells around the Swisher area.
And the Gazette's done some reporting on that, and across the country too, just about how airports, a lot of the firefighting foam used in those cases had PFAS, and even if there was no fires there, they were testing the foam, were required to test with the foam every day. So that's maybe the locus of that, although I don't know if that's definitive.
Yeah, that's what we're thinking the main source is. Also, the application of biosolids as a fertilizer to agricultural fields that has concentrated in PFAS chemicals, and that can find its way into the groundwater. Of course, they're not as concentrated as the firefighting foams or anything like that.
But you really need to understand the groundwater system to figure out where it's going to go, right?
Absolutely.
And I
Yep.
think that that's one of the things which we don't do on a regular basis. And so that's where a lot of the uncertainty comes, is it going this way? Is it going that way? How far away do we need to test to figure that out?
Aaron, I think I see this across my entire 9-state region. It is currently not economically feasible for a private well owner to test for PFAS. It just currently is not. They get this, as Ethan was pointing out, they do the $600-700 worth of testing and they find out they do have PFAS. Well, now they need $1,000-2,000 worth of treatment. And unfortunately with PFAS, the residual from the treatment, what's left over is concentrated PFAS. So now it needs to be disposed properly, which is another expense on that well owner to dispose of that properly. And then, so now you're in the, $5,000-6,000, maybe $10,000 range, just because you're trying to deal with PFAS being in your private water system. And unfortunately, when you put treatment on a system, you really need to test to ensure that the treatment is functioning properly. So you can't just stop testing for PFAS just because you stuck treatment on your system for PFAS. You really need to continue to test periodically, whether that be to a DNR standard where you may need to test monthly, or whether you take that to a more lax standard and you test every time you replace the filter to make sure that the new filter is going to be treating it to your specific recommendations or necessities. So a private well owner can really get mired down in major financial responsibility trying to deal with just keeping themselves healthy from this issue personally. And this is my entire 9-state region is dealing with this. There are tons of environmental health professionals out there and public health professionals that are trying to figure out how they're going to help these private well owners that are some of them are already very low income, and they just don't have the means to test for it or to treat for it or to continue testing for it to make sure their family's safe. And so I agree with Sylvia, something needs to be done, whether that be some type of subsidy to make the testing and the treatment cheaper, or whether that be the federal government coming in and cleaning up these sites and helping the well owners out. I'm not for sure what needs to be done, but something needs to be done, because you just throw a contaminant out there and then you tell the people to deal with it. And unfortunately, this is one of those that's super expensive to deal with.
I mean,
Jesse,
I think this is.
Go ahead.
Oh, Jesse, I do know that the bipartisan infrastructure law did include some funding for states to deal with PFAS, since it's an emerging contaminant of concern. But obviously, this is going to be an issue for a while, and more funding is absolutely going to be needed to deal with it adequately.
I was going to say that this is not different from the Superfund kind of situation, the circular law. You have, you don't necessarily know where it's coming from. I mean, it's forever, right? So it may be like you can't hold somebody liable for it. And so we need to have some kind of backstop to make sure that people's health is not compromised. And I think that's the direction that we should be moving towards.
So another thing that was surprising to me in my reporting is that to learn the bulk of private wells are not in the country necessarily, but they're just in the kind of the fringes of metropolitan areas. I wondered, is that because the city infrastructure isn't keeping up, or because residents outside the city limits don't want to pay the taxes to get the city water?
Both.
I would agree with that. Yep.
You see it all over. This is why my earlier statement, where a county may assume that their entire county is rural water or public water systems, don't ever assume that, because anywhere a rural water system gets near another rural water system, it's almost like opposing magnets. They don't want to get close enough that they have to attach onto the other one, or they don't want to get close enough to that small city that small city may ask them to attach on and take over their city. So you see these bands and rings of well owners just right outside of cities, right on the fringes of rural water systems all across my entire region. I can propose to that it's true, and some of it is the fact that well owners like to be independent. They just do. Some people move from the city to the property because it has a well because they want that independence. And a little education can usually get them to where they have safe, clean drinking water. Maybe they drill a new well, or maybe they put in some treatment or whatever. And then you run into the situation where rural water came by and offered everybody to hook on for a minimal fee, and those property owners opted out at that point in time. And then 20 years later, there's a new property owner that owns the property and they want to hook onto rural water, and now it's $20,000-$30,000 to hook onto rural water. And so they look at that and they say, well, I can drill a new well for $20,000. Why should I hook onto rural water? And so the cycle continues.
My understanding is that in Iowa City, we actually have some mobile home parks that depend on rural water, on well water. And so I think that's another interesting twist, which is you have these places at the fringe of town, right, that house people who are in disadvantaged conditions, most likely, and they are not the ones who would be able to do the testing. And what's the situation for those, for those mobile home parks? We don't know.
You're exactly right. And we rely on these community wells to be monitored and tested and treated by the communities themselves. And from what I understand, there's just not a whole lot of supervision going on there for what is essentially what would in any other place be a public service and would be highly regulated.
Another example of this type of circumstance is in places like southern Minnesota, for example. They would have confined animal feeding operation workers living in old rural houses that have that use well water. And these are people who immigrants, maybe they don't speak English, and how do we ensure that the water they're drinking is safe? There are a lot of environmental justice connotations to this problem.
You guys mentioned rural water systems. Is that just like a city system with pipes underground, but it's out in the country, or can you talk a little bit about that?
Anyone want to take this on? No? All right. Rural water system is basically just a larger system. It typically incorporates several different geographical locations. So it's not just a city. So a city will typically draw its boundaries and become an incorporated unit. And they'll say, okay, we have this area that we want to be. We're going to incorporate, we're going to become a city, and if you live within this, you're considered within the city limits. And rural water systems typically are not in city limits. They go all over the countryside. They go down your gravel roads. They go from one county to the next county, and they just cover larger areas. They are basically the same as a public water system. They're regulated by DNR. They're either groundwater or surface water, depending on how they're getting their source water. They have to meet all the same DNR requirements as any other system has to. And they're just providing bulk water on a larger basis. A lot of times you'll also see very small cities, like I said earlier, attaching on the very small cities. A very small city with a failing water system may apply for grants or loans from the state or one of the other entities to combine themselves with the rural water system. So rural water can either take over their town system, where they might buy bulk water from the rural water system to supply their town because maybe their wells are no longer viable or those types of things are going on. So rural water systems are just typically very large, broader. They're not just a city or an area. They're an entire area. If that makes sense?
Yeah,
Sylvia?
It does, but it's still like underground pipes. It's just in a broader area and maybe not in a small, like, contiguous area.
Yes.
And some of them will treat their own water. Some of them, as Jesse was saying, will buy water from, for example, the Des Moines Water Works. sells water to some rural water systems in central Iowa, and sometimes they will do both. So sometimes they will treat and buy treated water. But essentially, as you were saying, Erin, the pipes is the critical part that they work on, because that's a really complicated problem. I mean, you need to get easements if you're moving into new areas, if there is a new kind of like rural development. So they, in Iowa, they, for example, my understanding is that pretty much all of northwest rural Iowa depends on rural water, because you don't want to be drinking that water. It's very high in nitrates, given the concentration of livestock that we have in that part of the state.
So I have a couple questions related to PFAS, and we're going to come back to that in just a minute. But I wondered if there are any, in your guys' mind, is there any solutions to get these rural water systems and cities to collaborate more to kind of reach out to those border developments?
That's a very politically fraught question, Erin, because, you know, the cities don't want to give up their infrastructure, right? But sometimes it's very hard for them to maintain it, especially if you're a small town that's been losing population. So I think that one thing that would really help, in my opinion, is to have a conversation about what rural development looks like in Iowa and other states like Iowa, you know, southern Minnesota, Wisconsin. What does rural development look like going forward, given the trends, that the population trends we're seeing, the costs of these remediations that we're going to have to address, right? And I just don't think that we're very good at having these big, difficult conversations in this country. We kind of like sweep it under the rug.
Really quick, just because I think that I don't want people to get the wrong idea. A lot of groundwater is safe, clean, and healthy. If the well is constructed properly, the aquifer's been taken care of. There are a lot of safe, clean drinking water wells that are out there. So I am a proponent for people to have safe, clean drinking water. If they have a well and it's safe and clean and they're taking care of it and they're taking care of their family's health, there's absolutely no reason that they need to go spend money to be on a rural water system. If they have a poor construction well or they're having water quality issues, those situations, it is definitely a viable option for them to hook onto a rural water system. So I don't like, I don't want people to assume that this is a smear panel to get rid of well owners. You know what I mean? When you say, what can we do to get that rural water to expand? There are some regions of Iowa that have safe, clean groundwater. And as long as the well owners work together, wellhead protection areas, watershed protection, making sure that their groundwater is staying safe and clean for future generations to come, there's absolutely no reason they will ever need rural water in that area. There may be a very small minority of people in that area that are low income or such that cannot maintain their well, that may need additional assistance or may prosper with a public water system. But the majority of the individuals in that area, the whole reason rural water is not there is because they've said, no, our water's safe and clean. We don't need them to be here. And so they're moving on with what they have.
But I think I totally agree with this. I would say still get tested though, because you may have lead in your pipes because your well was poorly constructed or maintained, right? And so
Yes,
I don't
100%.
subscribe ever to the school of thought that people do have, as Ethan was saying, that not knowing is best. Knowing is always best. And then you can address the problem, you know? As I said, sometimes it's not coming from the outside. It's just it's a localized problem, but it still needs to be addressed.
Okay, I want to just make sure I throw in here this question about PFAS. So does water movement, this is from our audience, does water movement in shallow aquifers follow closely to the surface water movement, in which case future likely wells in that area could be contaminated, and that it's kind of predictable if you're looking at like a plume area of PFAS? And I mean, that's a little different than other contaminants, right?
You need a groundwater geologist. You need Jessica Meyer on the panel to answer this question.
Okay,
I can't necessarily speak confidently on that. I'm a chemist by training. I'm not a groundwater geologist.
that's all right.
I agree.
ahead, Jesse.
I'd shoot that at the Iowa Geological Survey. They'd be a great panelist for you guys to have on.
Okay, all right. Well, I tried audience member, but no, I appreciate that. It's an emerging area, and it is very specific to PFAS and different from others. Another question related to PFAS, not so much about drinking water, but do we have examples? You mentioned PFAS from biosolids, and just for our audience who aren't sure what biosolids mean, it's like human waste from wastewater treatment plants in most cases. Do we have any examples of PFAS from biosolids contaminating crops or cropland? I don't know if you guys know that. Sylvia, have you heard about that?
We I can't remember exactly, but I'm pretty sure that this has been found in I don't want to say the state because I don't remember exactly, but I'm pretty sure it's this was the case somewhere where they found the crops being contaminated by the biosolids. Yes, and then I don't know that we understand then what happens to those crops, right? If they're fed to animals or if they're used for food production, what kind of biomagnification issues there may be. So, but I am pretty sure that they did find PFAS contaminated biosolids used in cropland.
And just for perspective, I know that at one point in time they were applying biosolids up by the Eastern Iowa Airport, but that practice has stopped for a number of years. Just from what the airport had told us previously. Okay, so I want to spend just our last 10 to 12, 15 minutes here talking about policy. Sylvia, what laws exist at the state or federal level regarding private wells? What, if any, laws?
So this is like what I think is at the core of the problem we're facing is that the Clean Water Act and the Safe Drinking Water Act essentially leave well water drinkers on their own, right? And so all these laws that we've made to make sure that the water we drink is safe for us don't really apply to well water drinkers. It's up to them, right, individually, to address the problem. So the testing they do at Iowa City, the testing that the Des Moines Water Works does, the city of Dubuque, whoever, they have to do it on their own. And clearly, the more we learn about these contaminants, see PFAS, for example, the more it's clear that the scale at which the answer would be coming from is not appropriate to the problem, right? So we need to have some kind of federal level, because I don't think at the state level we have the resources. So, for example, Iowa has the grants to counties, but Minnesota has a similar program only for the southern part of the state. Illinois doesn't have a state level programs, but some counties will subsidize a test. So you can go pick up a test. And, so it's a hodgepodge that doesn't reflect the kind of scale of the problem. I don't know what Ethan and Jess have to say about this.
You're right. Yeah. Private wells have been left out of any federal regulations, and there's, like Sylvia said, just a patchwork of state and local efforts to try to understand the water quality in the area. I definitely think it'll take more of a coordinated, higher level effort to kind of close this loophole if this is something that we want to take seriously.
I think you specifically to Iowa, your original question was what regulations and what things are, if I'm right, correct? Iowa does have the well construction code. Let me see, it's 567.49, Iowa State Code 567.49. It is the Iowa Well Construction Code. So all new wells that are drilled in the state of Iowa must meet or be up to the regulation of the Iowa State Well Code. And so we are addressing it. The regulation is addressing new moving forward, but there is absolutely everything past the code is grandfathered in. So that's where you've got the people that are still drinking out of hand dug wells, or the large diameter wells that are in really bad condition, or the wells that are out in the karst geological area that only have like 20 feet of casing. Those older wells across our entire nation are causing major issues to aquifers. And so I could definitely see a place for new regulation on replacing or moving away from these older wells, something that would help. But yes, there is currently regulation on the drilling of new wells and the construction of new wells in the state of Iowa. So there is some regulation. It's just not regulation to the point of a public water system. But then you have to play devil's advocate. And a lot of these people with private wells, the whole reason that they want a well is because they don't want to be regulated. And so playing devil's advocate on the other side, do you take away their freedom, or do you let them continue as is? And so I think that's the major issue that regulators have at the state level as well. They have their own constituents saying, we want this freedom. We don't want you to come in and regulate our private drinking water. But something has to be, there's a middle place, and education is definitely a big piece of it. But there's always going to be those individuals that allow their well to be damaged or out of maintenance that causes problems to the entire aquifer as a whole, that we really should address nationally.
So you mentioned kind of addressing it nationally because of the hodgepodge in states. Is there a state that you guys are aware of? This is a question from the audience, that regulates the permitting and testing of private wells particularly well, that you've seen some success stories out there?
Iowa does a great job in our 9-state region. Iowa has the Grants to Counties program. They have the well code. They provide a lot of great education. They have an environmental health professional, if not in every county, but covering 2 or 3 counties in some cases. I think Iowa does a really good job with groundwater protection. Minnesota's pretty good as well, above you guys, and then you get everything from 0 to 100% across the rest of the United States. So I mean, there are still states with no well code. They have no well construction code, so people can just go out in their backyard and stick whatever they want in the ground and call it a well. And so there are issues nationally on.
So have you, Jesse, in your region, have you seen anything innovative on this front? Just kind of, even if it's real isolated.
Wait a minute, I'm still muted. There we go. Innovative in the regulatory side?
Yeah, or just like how, they're doing permitting, or just, anything beyond like the grants to counties.
God, the unfortunately, it really boils down to Ethan. I mean, really, in a lot of cases, it can change from, there'll be a well owner on this side of the county line that has Ethan and he gets all this great support. And there'll be a well owner on the other side in the next county that has zero support. The environmental health professional won't even talk to them. They don't have anything. So, I mean, it really boils down to the Ethan level with private wells. Since it's not a huge issue at the state or the federal level, a lot of times when you see something that's not regulated, it really doesn't matter to our regulators, right? So they may have a little bit of money for it, but they just kind of throw that at the county and say, here, we don't regulate this, we don't care. So here, take this money and do something with it. And if there's not a really great Ethan in that county, then you don't see any really great stuff going on. I mean, that's a lot of times what I see at innovative. It's usually an environmental health professional at their county level that says, hey, I want to take this money and I want to have public health fairs and I want to knock on doors and I want to go out there and meet my people in my county and make sure that they're safe and they're having good, safe, clean water. And so that's what I see is that human factor at that county level. And if somebody doesn't pick that up at the county level and say, I really want to do this, if they say, well, I'm really overworked and wells is just another one of my hats. So if somebody walks in my office and wants a test, I'll hand it to them, but that's it. Then that's what you're going to get.
That makes sense.
I was
Go
going
ahead,
to
Sylvia.
add, Erin, that I think another problem is what is the kind of like attention being paid to septic systems? Because I used to live in Southern Illinois, and the level of disrepair of septic systems and the kind of like, it's not just that the landowners, the well water owners have to do due diligence. It's that you have unregulated. I mean, some of the stuff that we saw down there was just appalling, And so, when you think about what we're doing for people who drink the water, well, what are we doing about the people who are causing problems to that water? Also has to be part of the equation.
Yeah, and I can chime in on the septic system piece that Sylvia brought up. Here in Johnson County specifically, we have a septic density regulation around the Coralville Reservoir and around Lake McBride, limiting the density of septic systems just to protect our surface water there and our groundwater. So I would say that we do a pretty good job with regulating our septic systems here, but we still do run into failing systems that are thankfully caught by the time of transfer program through the state, where anytime, in most cases, there are some exceptions, anytime a property is sold that has a septic system, it has to be inspected and tested. Some counties that have less resources, even in Iowa County and Louisa and Muscatine County, they have different requirements for septic permitting. Here in Johnson County, we don't do the engineering for septic systems, but in some of those other counties that I mentioned, they provide plans for people who are planning on putting in a septic system, and they'll just hand the form over, hand the plan over to the applicant. So, there's still state regulations on what can be called the septic system, but again, it's really up to the level of funding that state environment or county environmental health programs have. And that determines how much attention they can pay to these.
Yeah, we have, I'm just going to try to fit in one more question from the audience. They're saying from, what we've been talking about here, no matter how well, like cities' water may be treated, it could still, they're wondering, can it still come out of the tap contaminated because of pipes in and near a house? And I know that's what we saw in Flint, Michigan, but is that happening a lot around Iowa? The people's in-home drinking water, not necessarily from private wells, but is contaminated with lead from pipes.
You're talking public water systems as well?
Yes.
The new lead and copper rule that came out, I want to say last year or the year before, has really narrowed down and targeted in on lead and copper nationwide. And so I'm not DNR. It'd be great to have DNR on to speak with you, but I know that Department of Natural Resources in Iowa, they are enforcing the lead and copper rule on public water systems, which is requiring lead service pipe surveys, multiple sampling points throughout places like schools and other public locations. And so the new lead and copper rule, although we don't like regulation, it really piled on a lot of additional regulation to make sure areas are safe from a Flint, Michigan style issue, where Flint, Michigan didn't have a lead issue. They changed water sources. The water source had a corrosive, and then they had a lead. So they always had a lead issue. They just changed water sources, and it brought the lead issue to the front. So what the new lead and copper rule is trying to do is it's trying to identify those places in public water systems that, if they did change a water source, would become an issue in the future, and replace those and get those out of those systems. So it's fairly new. A lot of systems are struggling with the new lead and copper rule, trying to make sure that they're implementing it properly. But I can tell you that just putting a little bit of research into that, maybe getting a DNR person to talk to you, could definitely highlight that for you, let you know what's going on.
That's great. Well, we're going to have to finish up here. Lots of great questions and lots of great insight from our panelists. Thank you so much to our panelists today, Ethan Turbin-Furman from the Johnson County Public Health Department, Sylvia Secchi from the she's University of Iowa Professor of Geographical and Sustainability Studies, and Jesse Campbell, Private Well Coordinator for the Midwest Assistance Program. And thank you to our sponsor for In-Depth Week, James C. LaRue of LaRue Law Office. Join us tomorrow at noon for a panel discussion about the nutrient reduction strategy. 10 years into the policy, how is it working to reduce nutrients in Iowa's water? Thanks all and have a great day.
Thank you. You as well.